Hello, hi, I'm Dr. Nagat Arif. Let me show you how a coil is removed out of the uterus. The removal of an intrauterine device, IUD, such as a copper or a hormonal coil, which is sometimes known as an IUS, are both commonly referred as coils, is a relatively simple and quick procedure that's typically performed by a doctor, someone like me, or a nurse who's trained to fit and remove coils. Let me show you how the procedure is done. Firstly, you need to schedule 2 appointments. One appointment to go through the coil, what it's like for you, what experience you've had with it, and then the next appointment would be actually coming in for the procedure to have your coil removed. Here's a little tip. If you still have periods on the coil, it's usually recommended to have the coil removed during your menstrual cycle if you can time it that way. That's when the cervix will be slightly open, which makes the removal process a lot easier. But I know how hard it is to schedule it that way, so don't worry about that, but it's just a tip some people find useful. Before the removal, your healthcare provider, your doctor, may ask you some questions about your experience of the IUD and the symptoms or concerns that you might have had, and whether they need to also at the same time perform a pelvic examination to locate and assess the position of the coil or the IUD. The removal procedure, what happens there is during the removal procedure, you will lie on an examination couch, possibly with your legs in stirrups. So it's similar to when you initially had it inserted. Your healthcare provider will use a speculum to gently open the vagina and cervix and to visualize it. At this point, having pain relief is really important. So depending on your pain threshold, you should take 1 gram of paracetamol an hour before your coil removal appointment and 400 milligrams of ibuprofen if you can tolerate it. If you have vaginal atrophy, please use vaginal estrogen topically for a minimum of 3 months before the procedure, as the insertion of the speculum at the time can be uncomfortable, and if it helps to use your own vaginal moisturizer, because then you know what suits best. What I do in my consultation then is I use lidocaine spray at the neck of the womb to help prevention of any pain or cramping. So let me show you, once the doctor's put the speculum in to have a look at the neck of the womb, if the coil strings aren't visible, then don't panic. There's a device called a coil string hook, so it looks a bit like this, that can be inserted into the neck of the womb to hook out the strings if we need to. The doctor and nurse will then use a specialized instrument called a tooth-longed forceps to grasp the strings attached to the IUD and carefully pull it out. The sensation during the removal can be that it can be a bit discomforting and you might get a mild pain. So it's similar to that of maybe getting a little bit of a cramp. Some women can feel it a bit like as if when they had the coil insertion. You might get some sensation of cramping or pain or discomfort, but it doesn't last for long and it usually subsides a lot. That's why having ibuprofen and paracetamol to hand is really important. Nearly all my patients that I take the coil out of actually don't experience any pain at all. It is so variable. After the coil is removed, your healthcare provider might examine the coil just to make sure it's intact, and they might then want to address any concerns you might have regarding alternative contraception, what you might want to go on. Or if you were using the Mirena coil for HRT, then your doctor might provide you alternative options for progesterone component of your HRT as well.